So then, you come in, knock on the door, introduce yourself, name and title, address the patient by name, let the patient know that you're here to provide the bedpan. You're going to go wash your hands. After you wash your hands, you're going to come back. You're going to check the ID and make sure that it's the correct person that you're supposed to take care of. You're going to provide the privacy. You're going to lock the wheels, and you're going to raise the level of the bed. Your equipment consists of chuck, mattress pad, and gloves. Now, if you have nice clean uniform on, you are to place your nice clean gloves inside of your pockets of your uniform. So if you have your uniform smock or your pants, you put them in your pants pocket or in your uniform smock or in your top pocket. So I don't have a smock on, so I'm gonna just put them like so. So the patient is lying in the bed. You're going to come with the mattress side, which is like the plastic side, goes to the mattress. The cloth side is going to touch the patient. So you're going to gather the mattress pad like so. You're going to come to the middle of the torso. So you're going to place it underneath their buttocks. You're going to ask the client to bend their knees. Right? Bend them some more. Okay. This is what you're going to do. The count of 3, I want you to bend down on your feet, and I want you to lift up your hips towards the ceiling as far up as you can. So I can place this underneath. The count of 3. Okay. 1, 2, 3. Okay. So now, the mattress pad is directly underneath her in the midsection. This will prevent from the bed getting soiled by any urine or feces. Okay? So the person's on the mattress pad. At this point, you're going to put on a fresh pair of gloves. You're going to come down here and get your bedpan. This chuck, you're going to fold it and leave it here on the side. You're going to hold the bedpan with your left hand. Your right hand, you're going to use it to support the lower portion of her back and help her to lift as far up as she can, because you got to place this underneath her, and this is wide. Okay, it's wide. So she has to really lift. Okay, Ms. Jones, we're going to do the same thing again. You're going to bear down on your feet. You're going to lift up your hips as far up as you can, but I'm going to help you. I'm going to put the bedpan underneath. Okay? You ready? 1, 2, 3. Now it's going to feel a little uncomfortable. When I start raising the head of the bed, it might shift a little. You let me know, and I'll adjust it for you. Okay? All right. So now, she's underneath the bedpan. Now we have to raise the head of the bed so she can sit up onto the feet. No, not feet. Not feet. Don't worry, I got a trick for that. So you're going to lift up the head of the bed, which in this case, the head of the bed is not working. You're going to lift the head of the bed, and the person's going to be sitting up. Wait. Okay, now. She's going to be sitting up on the chuck. On the bedpan. You okay?
Yeah.
Okay. So now, you have her there. You're going to give her the roll of tissue. When you give her the roll of tissue, you have to instruct her what to do. Ms. Jones, I need you to wipe from front to back and drop the tissue always in the bedpan. Okay? When you need me, you call me. Fall down. You're done. Okay? So, now, you're going to go to the sink. You're going to remove the dirty gloves. I come back. Ms. Jones, you done?
Yes.
You finished? Okay. So she's finished. I have to go and wash my hands before I touch her. Wash my hands. After I wash my hands, I'm going to get a washcloth. I'm going to make it wet, hot water. I'm going to put a little bit of the bacterial soap on it. And I'm going to bring this to her. This is for you so you can wipe your hands. Okay? While she's wiping her hands, I'm going to put on a fresh pair of gloves.
So you wash your hand 3 times?
So far.
Okay.
I'm going to take this from her, clean her hands with it. Take the tissue, put it back in the drawer. And we're going to lower the head of the bed first. So she got to be flat again. So I'm going to lower the head of the bed. It's flat. Now we're able to remove the bedpan. She needs to bend her knees. We're going to grab the mattress pad and the bedpan at the same time with your left hand. You're going to grab everything. With your right hand, you're going to support the small of her back. Okay, we're going to do the same thing again. You're going to press down on your feet. You're going to lift up your hips as far up as you can from me, and I'm going to remove everything from underneath you. I'm counting to 1, 2, 3. She lifts. Okay, come down. She's okay. You cover, because you don't want the fumes. This goes in the hamper. We're going to over here. This goes in the garbage. This goes in the commode. You look. If it's urine, feces, whatever. Everything goes in there. Tissue. Water. Water should be tepid, room temperature. Come in. Test it.
1 second before they go for break, could you call me? I need to speak to them.
Sure I can.
Thank you.
Water. First water, dump. Water. Soap. Tissue. Wash. Dump. Water. You gotta rinse the soap out. Dump. The last water can go in the sink. Tissue. Dry it. New chuck. Cover it. And place it back. Go back to the sink. Take off these dirty gloves. Fourth hand washing technique. 4. This is number 4. Wash. Go back to the client. Give her a pull belt. Open up the curtain. Make sure the bed is lowered to the fullest extent. Wash your hands until the process is still complete. 5 hand washing techniques. 5. Yes, ma'am.
So after you wash your hand over there, gave her the call back, you wash your hand again?
Yeah, before I leave out the room, I always wash my hands.
Okay.
5.
5 hand washing.
5 hand washing techniques. It's like real serious. And they're counting them